Hello everybody. We are going to talk about intrauterine fetal death problem. At first, the history: a 34 years old woman at 32 weeks and 4 days in her gestation and first pregnancy. I mean it's prime gravida, 32 weeks in gestational age plus 4 days. Complain of reduced fetal movement. She normally feels the baby move more than 10 times each day, but yesterday there were only 2 movements and today there have been none. She has no significant medical, obstetric or gynecologic history. In this pregnancy she booked at 10 weeks her usual antenatal visits, and all booking blood tests were normal, except that she was discovered not to be immune to rubella, and postnatal vaccination was planned. Her 11 weeks and 14 weeks scan nuchal translucency test. This test is for Down syndrome, and the anomaly scan were normal. Examination: blood pressure is 137/73 mm mercury, pulse rate 93 beat per minute. She has a pyrexial, mean normal temperature. The fundal height of the uterus is 31 cm and the fetus is breech on examination. According to fundal height, is calculated but we called McDonald formula. After this is McDonald formula. What is McDonald formula? After 24 weeks of gestational age, the fundal height in centimeter is equal to the gestational age in weeks. Okay, the fetal heart is auscultated with handheld Doppler and no heartbeat is heard. An ultrasound scan is therefore arranged immediately, which confirms the diagnosis of intrauterine fetal death. What is the management of this case? Are there any factors in the history or examination to indicate the cause of fetal death, and what investigations should be performed to establish a possible cause? Answers: according to the management, was 4 weeks for spontaneous expulsion if failed or the mother is anxious, termination of pregnancy to avoid the possibility of sepsis or disseminated intravascular coagulopathy developing, is achieved by induction of labor with mifepristone, which is anti-progesterone. Progesterone has a relaxant effect. Okay, followed 24 hours later by misoprostol, which is a prostaglandin analog to induce uterine contractions. The woman can go home temporarily after the mifepristone to avoid added stress from being admitted on antenatal or postnatal ward. In labor, adequate analgesia is essential and patient-controlled analgesia is useful. Cause of intrauterine fetal death in the history: the only potential significant factor is lack of rubella immunity. This is unlikely to be significant, but rubella immunoglobulin or IgM should be checked to exclude recent infection. The recent infection or modern infection by IgM, modern infection IgM, or rising titer of IgG. The examination is normal except for tachycardia, which may relate to anxiety and should be rechecked. The woman can go home The possible causes of intrauterine fetal death: maternal causes, fetal causes, placental causes, and the unexplained intrauterine fetal death. About the maternal causes: diabetes mellitus, infection by parvovirus, listeria, thrombophilia like antiphospholipid syndrome, DVT. Fetal causes: chromosomal abnormality, trisomies, as in Down syndrome, hemolytic disease of newborn, hemolytic disease, cord incident like notes in the cord, placental causes like placental abruption, placental insufficiency, post-maturity, and unexplained. Investigations could be done on maternal and fetal. Maternal CBC coagulation profile to exclude DIC thrombocytopenia secondary to fetal death. Exclude diabetes by random blood sugar and the hemoglobin A1C. Kili-Heart test or Kili-Heart test for fetal maternal hemorrhage. You will discuss it in details in the the lesson of Vasa Previa, antenatal hemorrhage. Anticardiolipin lupus anticoagulant for antiphospholipid syndrome diagnosis, which is a thrombophilia. Okay. Fetal swab for microscopic cultural sensitivity from the fetus and the placenta. Skin biopsy for karyotyping post-mortem if agreed by the parents. Key point in this problem: intrauterine fetal death is commonly unexpected and unexplained. Induction of labor should be arranged as soon as possible, as there is a risk of development of DIC or sepsis. Thank you.